My name is Dr. Manish Viaish. I am a neurosurgeon at Max Hospital, Vaishali. A neurosurgeon is a surgeon who performs brain surgeries as well as the spine surgeries, and we at Max Vaishali does most of the complex surgeries referred from all across India and the world. Today we are going to talk about the common symptoms and management of the brain tumors, and also we are going to talk about the common myths about the spine surgery and what can be done to improve the quality of life in cases of brain tumors and the spine problems. So coming to the brain tumors, there are two kinds of brain tumors, benign and malignant brain tumors. The common symptoms of a benign brain tumor is usually headaches, blurring of vision, early morning vomitings, and sometimes seizures or epilepsy as it is called in the common parlance. There could be progressive weakness of one of the hand, leg or any other part of the body, or there could be a progressive facial deviation, double vision. So these are the common symptoms in case of a benign brain tumors. In case of malignant brain tumors, the most common presentation is usually epilepsy or seizures, and the common symptom in both kind of brain tumors is they are more severe in the mornings as compared to the migraine which progresses through the day, while the brain tumors, they are more common in the morning, they are relieved by the vomitings. Now the early detection of brain tumor plays a very important role in achieving good results and achieving a cure. The early detection of tumor can be done once your physician or a neurosurgeon advises you for an MRI. MRI is the best modality to detect a brain tumor, which is usually done with the contrast media, and this helps in diagnosing the location of the tumor, the type of the tumor, and then a surgical planning is done by a neurosurgeon. The recent advances which actually helps in the improving the quality of life and increasing the longevity is the new technologies called neuronavigation, for which we do a tractography or a functional MRI. In this, we ask the patient to move their limbs, we ask the patient to speak few words, we communicate with the patient, and all those signals are caught by the MRI, which then tells us which fiber is going from where, what is its relationship with the brain tumor, and all this information is then fed into the neuronavigation system. Now this neuronavigation system guides us real time in 3 dimensions, which is the best path to take out this brain tumor. That is one part. And once we have reached to the tumor, we use intraoperative ultrasound guidance. So it further defines in real time where we are in 3 dimensions, and it differentiates from normal to abnormal tissue, which is actually helpful in the malignant brain tumors. Then thirdly, what we do, we use an intraoperative electrophysiological monitoring. In intraoperative electrophysiological monitoring, we stimulate the brain part before taking it going further, so the safety margin increases, and it is further aided by the awake craniotomy. When the patient is cooperative, we can ask the patient to either play some musical instrument, or we keep on talking to these patients. So we know that we are not doing any harm to the patient. The first and foremost is, on any surgical branches, first do no harm. That is the crux of it. So once we have these kind of recent advances like neuronavigation, tractography, these all are fed into the system, patient is taken to the OR, a small cut is made, or at many a times we do through the nose, the tumors which are on the base of the skull, and we take out the tumors, and this actually improves with all these modalities, it improves the quality of life. Quality of life means the patient have a more of a going back to the work or going back to the normal life, the chances increases many folds. As well as in case of a malignant tumors, once we have these modalities, we can confidently do radical resections so that the post-operatively, if any other treatment like radiation is required, then the results are better and the quality of life and the span of life increases. Having said that, do not ignore the symptoms. As I said earlier, an early morning headache, sudden blurring of vision, double vision, difficulty in swallowing, or if you are hearing using a mobile, if you are hearing less from the one ear, then it could be a small benign tumor growing on the one of the nerves. So all these small symptoms like gait imbalance, we have up in the smaller part of the brain, the hind brain, it controls our balance. So if there is a small tumor in the hind brain, then it can actually, the patient can present with just simple difficulty in walking. So early detection helps a lot, and the technology has advanced so much. Now I've been practicing neurosurgery independently for 20 years and prior to that about 14 years of training. So what we have realized, the technology in past 10 years and more so in past 5 years have increased in leaps and bounds. We are come from whether the patient is survival or not survive to how soon patient is going back to the work. That is the main difference in today's technology. I mean, if I say it in Hindi, then जिएगा या मरेगा से काम पे कब वापस जाएगा, क्वालिटी वो अपना बच्चों के साथ में कब बात कर सकता है, अपने डे टू डे रूटीन कब कैरी कर सकता है. सो वी हैव कम टू दैट लेवल. द न्यूरोसर्जरी और ब्रेन सर्जरी इज नॉट ऑन चांस now. It is a definitive improvement in the quality of life, which is the goal of any brain surgical procedures. Thank you.